I am very excited. My name is Sarah Foggy, and this is my second year participating in the summit. I am the trauma coordinator for Gottlieb Memorial Hospital, which is an affiliate of Loyola. I'm happy to be here working with my colleagues that are also affiliated with Loyola, and I'm happy to introduce them to you. All of them are doing great things on our campus, in our community, for our patients, for our community members. And so I'm so excited that they have agreed to join me today, join us, and just discuss some of the things that they're doing within their roles at Loyola Health and Loyola University. You know, there's a certain connection that happens when two strangers, I'm a nurse, when two strangers, I've met many patients that come into the emergency room that have been victims of trauma, victims of gun violence, and that they trust me with their care and they trust me with their life at that point in time. I'm very honored. However, the effects that happen when that patient leaves the room or that patient goes back home, knowing what we know from and what we learned from today, that there's a potential that this could affect that person for the rest of their lives, their family, their friends, their community, their job. So I've made it a goal of mine and a part of my community service to have discussions at the bedside with patients, to have those hard discussions. What made you do this? What got you into this? How can we help you today? How can we prevent you from being so angry that you go out and do this again? So I just want to introduce our panel because they're going to discuss some of those things that we're doing on our campus to prevent gun violence. So first, I'm happy to introduce Dave Olson. He is a professor at the university. Michelle Cavosi, she is also a professor at the university and a lawyer. Scott Grant, over 20 years of healthcare experience. He does our public safety for Loyola University campus, Gottlieb and McNeil. Tim Cunningham, he's also part of public safety for Loyola University. Dr. Purvi Patel, trauma surgeon, also deals very closely with patients that have been victims of gun violence. And then Amanda Oliver, who is our injury prevention coordinator for Loyola University Health Center. So I'm happy to introduce all of them. Thank you. And I want to give them about 5 to 7 minutes each to introduce themselves to you and discuss what their role is to combat gun violence.
Can you hear me okay? Yeah. All right, great, thanks. Well, thanks for having me and thanks for everybody's attendance. I'm going to tell you some things that are a little different than what you've heard because the role that I play and how we approach the issue is a little different than what you've heard. What you've heard is the really important stuff. The stuff I'm going to talk about is a little bit further removed from what the people that were on the panel previously are dealing with on a day-to-day basis. So again, my name is Dave Olson. I'm a professor in the Department of Criminal Justice and Criminology at Loyola on the Rogers Park campus. The one thing I want to say that's been great over the last 3 to 4 years is the welcoming nature of the Loyola Stands committee and organization. I think we might have been the first non-health sciences group to find out about Loyola Stands, get involved in it, and it's been extremely beneficial, not only to get to know people doing different work, but also to educate people about some of the things that we're doing. And I wanted to just give you a little bit of a sense of the Center for Criminal Justice at Loyola, which I co-direct along with a colleague in the Department of Criminal Justice and Criminology. So back in 2015, then president of Loyola, Father Garanzini, ran into me on the elevator. It was a time when there was an increase in gun violence in Chicago. And he said, we need to do something about this. What are some things we can do? I'm a social scientist by training. I do research and program evaluation in the space of criminal justice. And so obviously what I thought we could do is the stuff that I could do. And so from that conversation, myself and colleagues created the Center for Criminal Justice. What we do is we provide research and evaluation support to criminal justice policymakers and practitioners dealing with a broad array of crime topics and crime issues. We're doing some specific things in the gun violence space that I'll talk about in a moment. But our ultimate goal is to improve public safety and improve the effectiveness and fairness of the criminal justice system response to crime and violence. And we do that primarily by partnering with elected officials and units of government to carry out research that helps them to implement and create more effective public policies. Specifically within the area of firearm violence, a few things that we're doing just to highlight what we do. One area that we work in is in research. So we do research to evaluate programs to better understand issues around firearms and firearm violence. We're doing research in Chicago with an organization, the Heartland Alliance and Ready Chicago, to evaluate a program that they have created within a prison in Illinois to identify individuals that are at risk of victimization or perpetration of firearm violence and improve their success at reentry. We're also working in the city of Rockford with a program that they've developed to identify individuals that are at high risk, again, for victimization or perpetration, and provide them with the types of social services and support to help them break the cycle that they're in. We also did what I consider to be fairly groundbreaking research that examined the response of the justice system to what was pointed out earlier in terms of the low clearance rate for violent crimes committed with a firearm. What we've seen occur, and it's been highlighted recently in a number of things that came out of our research, is the increased focus on individuals that illegally possess firearms, identifying them, convicting them, and in Illinois, most often sentencing them to prison. What we see that as is an inefficient and broad net that is cast with the hopes of reducing violence, but likely catching up in that net a lot of individuals that are engaged in that behavior, not with the desire to commit violence, but fear of their own safety and the need to protect themselves. And so that research has been helpful in getting us to better understand when we hear law enforcement talk about apprehending people for aggravated unlawful use of a weapon, that what they're talking about is somebody that illegally possessed a gun. And by illegally possessed, it means that they didn't go through the process that's required in Illinois to legally carry a concealed firearm. In most states in the country now, you do not need to do anything to legally carry a firearm for self-protection. So we've tried to uncover that issue. It's obviously a challenging one, right? Because you want to make sure that people don't engage in risky behavior, but you also want to ensure that the response to that is not only a punitive response and only one that leads to larger numbers of young Black men in prison, but a response that actually changes their exposure to risk and their ability to be safe in their own community. The last thing that I'll talk about is we also work with a lot of government agencies to help them craft and evaluate their responses to gun violence. So one of the things that we're involved in that I'm proud of, because it really does reflect that our approach isn't just a criminal justice approach, but also incorporates prevention and public health approaches, is our center is a member of the Illinois Firearm Violence Research Group that the Illinois Department of Human Services created after the Reimagined Public Safety Act in Illinois was created. So if you're not familiar with it, it was a law passed a couple of years ago that allocates substantial resources to the Illinois Department of Human Services to provide funding to community organizations in communities that are most impacted by firearm violence to develop and implement effective prevention strategies. And so we're working with the Department of Human Services and that group to help identify the communities in greatest need based on data and research, but also to help them think through how will we evaluate this so that we can articulate and present the effectiveness of these types of investments in prevention. So thanks for the opportunity to participate. I'll be around after this. So if you're more interested in our work, feel free to come up and talk. So thank you.
Thank you. And hello again, everybody. You met me. Michelle Cabusi. I teach public health law and public health policy in the Masters in Public Health program here at Loyola and in the Bachelor of Public Health program. I've been with Loyola since 2015. Prior to joining Loyola, I was a health law litigator, which basically just means that I represented mostly corporate healthcare clients in federal and state courts. For many, many years, however, I've been involved in gun violence prevention efforts. And I want to, I come at it from a bit of a different angle than many people here. Because I've lived in Chicago area my entire adult life, but grew up in a very, very different community. I grew up in a rural area where hunting and gun culture was the norm. My parents were not hunters. My parents were not gun owners. I was not a hunter or a gun owner. But that was the norm. So as a sixth grader, I had hunter safety in public school. The first day of doe season and the first day of buck were days off school. Those were days off school. And it was just part of the culture. I couldn't begin to count the number of families in my communities that had a gun cabinet in their living room, and you never felt unsafe. It was just the norm. And I'm telling you this because to help, we talked about changing the culture of gun laws or changing the culture or surrounding guns. But I do think that there sometimes is such a disconnect between people living in such different parts of the country and in such different realities. And so I didn't grow up with a fear of guns. And so many people who to this day strongly oppose gun laws didn't either. And I'll give you kind of one tangible example of that. In 2000, I went back to this rural area with my husband, then fiance. And we were there with my sister and her then fiance, like kind of in a wooded area, and we got lost. There's a man walking down the street. This was before GPS on our phones. And so my sister starts to pull over to ask this man for directions. And my now husband is like, what are you doing? He's kind of getting all agitated and you can't ask him for directions. And my sister and I have not one clue why he's so agitated. And he says, he has a gun. Well, indeed, he had a rifle strapped to his back. So we're like coming up behind him with the rifle strapped to his back, but we didn't notice. Like it didn't concern us. It wasn't a reason not to talk to him. And he gave us directions and we moved on. But I tell you that sort of in part illustrate why, we've talked about the power of the NRA and messaging, why their messaging for so many years, one gun law is going to equal another gun law and they're going to take away your guns, and why there's so much opposition to that, because it's a way of life that is not perceived to be dangerous. Okay, so back to what I do at Loyola. In my public health law classes and policy classes, I generally start, with a picture of or a slide, with the scales of justice. And I say public health law is at its core the balancing of individual freedoms with the welfare of the public at large. And so we talk about in my classes, the students in my classes are people who want to promote health on a broad scale. And so we talk about how different levels of government and different types of laws can help effectuate those changes. Kind of the classic, most obvious example of this in public health are vaccine mandates, right? There is it, and most of the students in my classes are scientists. You know, they're scientists, they're healthcare providers, they intend to be healthcare providers, and they come from an education and culture where just as Dr. Olson has talked to us about, where good science, good research forms good policy, right? Good science, solid research is at the foundation of all good public policy. And that is absolutely positively true. But what I try to stress in my class, including in particular, in when it comes to gun violence prevention is, you know, good science and good policy doesn't give you the house, right? That's the foundation. That's the foundation. You're not going to get to the finish line with that. You have to understand politics. You have to understand politics. You have to understand how these things work, how we are where we are, and how we have gotten to where we are. And in her opening presentation, Chris Brown did a masterful job of presenting, you know, so many laws and so much of the history of the laws in our country. I'm not going to repeat the things that she said, and I do wish I could present as well as she did. You know, again, thank you to her. But that's kind of what I do here at Loyola. I had, you know, pages of discussion of some of these laws to share with you, but Ms. Brown did that. So I will, I won't go into that for now. Feel free to email me with questions afterwards, and I will get back to you. I do also want to touch upon one thing a little bit outside of what I do specifically at Loyola, but it's kind of pertinent to what we've talked about, especially as I see these Mom Demand Action t-shirts in the audience, and we have our wonderful participants, and we've talked about this grassroots movement that is Moms Demand Action. 10 years ago, in the wake of the Sandy Hook shootings, I got involved with Moms Demand Action at the beginning. I was with Shannon Watts, a group of other people. You know, we didn't have Zoom then. This was all like telephone calls and emails with each other. And we were working on trying to get enhanced background passed. Can you still hear me? Enhanced background checks passed. And you know, we were trying to get support from people across the country. And I remember in South Carolina, we had one individual who was supporting us and reaching out to their elected officials. And now Moms has thousands upon thousands upon thousands of people. And it's amazing. It's amazing. Something else from that experience, that background checks bill, which was called Manchin Toomey, did not pass the Senate. And it seemed as if it was going to pass. And the day before, the votes fell off. And Democrats voted against that bill too. And Joe Biden, who was the vice president at the time, gets on the phone with, you know, it was not a private phone call, it was probably 50 of us at least, 100 maybe, who had been trying to work to get this passed. And he said, you know, he spoke with Heidi Heitkamp, who was a Democratic senator, about why she changed her vote in the end. And she said, I'm not going to have the numbers perfect here, so don't quote me, get the general gist. You know, she said, I understand that the overwhelming majority, I think it was something like 85–90%, the overwhelming majority of people in my state support the back legislation. But it is the 10% who have been flooding my office with phone calls, who have been emailing, who have been coming here, who are going to make sure that I am not reelected. And that's why she and others voted against it. And so when people are saying, you know, the other local advocates are saying, no, your politicians, reach out to them. That's what we're talking about. It absolutely matters. Thank you.
Morning, everybody. Thank you very much for having me today. I'm Scott Grant, the Regional Director of Public Safety for Loyola Medicine. I just came here to share with you guys what we're doing for Loyola or at our campuses across the board, and kind of how we're trying to embrace what is happening in our country at this time. Here in the Loyola Public Safety, we are embracing education and preparation. Education being, we want to make sure that our associates are as prepared as they can possibly be, and they understand these situations are evolving. The FBI, Homeland Security, they have some great information on stuff such as this. We embrace run, hide, fight here at Loyola. Run if you're in the immediate area and we have an active shooter event. Hide if you have to, and fight as a last possible resort. This is interchangeable. You do not have to, run, hide, fight, and just select one. You might be running in one moment and then you run into danger. You're going to have to hide, find a room with a lock on it. You're gonna, maybe you're hiding and then you have an opportunity to run, use that as well. But what we want to do is we want to get people thinking about this kind of stuff, our associates, our colleagues, our visitors in the place. Because of this, we changed to plain language across all of our campuses so that people understand what's happening. Before in hospital culture, we have code red, code gray, would be a security emergency, and code silver was our active shooter, armed intruder, active threat. Now it's being announced as just what it is, to be able to give people a fighting chance. We understand that, as these situations continue to evolve, we have to continue to evolve our education and make sure that everybody understands. So we encourage everybody to educate themselves on their surroundings. This isn't just here today, just as many of my partners here have mentioned, it's a problem everywhere. This can happen at Applebee's, it can happen at the movie theater, it can happen at the hospital, it can happen wherever. So we encourage people to take a look at their surroundings, make sure that they understand their exits, make sure that they try to remember run, hide, fight, make sure that they're educating themselves, as I mentioned several times. So here specifically, what we do in our orientations is make sure that all of our nursing associates or people that are coming in to work for us and our colleagues, they go through orientation. We talk to them about run, hide, fight. We talk to them about understanding their fire plans, their exits, strategies. We also do this annually. We have armed intruder training on our health streams and make sure that they're getting that dose after they're done with their orientation, because it's very important to continue to refresh yourself on this. And if there's any new information, we're making sure that we're putting it out there for you. We also do in-services security-wide across our region. So we visit the floors, we visit departments, we go to department meetings to try to talk about this and try to map this out with our associates so that they understand, what their escape plan would be, what they're hiding, and then if they have any questions, they can ask us. So now that's kind of the education part of it, where you're making yourself familiar with the situations that are happening, understanding that active shooter events take a matter of minutes and you need to be able to protect yourself. Now we're on to the prepare portion of what I want to talk about. So the prepare portion are things that our organization is doing to be able to prepare for an event such as this. So we've created go bags. Go bags we have across our hospitals. Several of them are in play, and they contain maps, active access cards, keys, everything that a police department would need to be able to access the entire facility in a matter of moments. Security on our campuses are not armed, so we work with our partners like Tim, who you're going to hear next, and stuff like that, to ensure that our security departments are best supporting the police when we do have an event, or if we did have an event such as this, that we're making sure that we're getting them the go bags, that we're getting them the information, and that we're supporting them in the best way possible. We want to develop relationships with our local police departments. We like to talk to them and understand what their training is and what they're going to be doing when they come in. You guys hear stuff like stop the bleed. These are things that happen. Like every time something like this happens, it's incredibly unfortunate. We lose lives, but then also, there are things that are put into place because of that. Stop the bleed, came years and years after Columbine, when, Tim will be able to share with you in the beginning of these active shooter events, a lot of victims were bleeding out because it was taking too long to get them the medical attention that they would need. So these are the things that, we try to understand from our police departments, try to understand from our fire departments that work with us on these plans. Here, specifically in our Loyola Maywood campus, we have two policing agencies that work with us. Our LUC police, who are here on their buildings, but then they're more than prepared to be able to help us in the event that we did have an event. And also we do employ Cook County in our emergency department and on our campus from 6 p.m. to about 3 o'clock in the morning. For continued support when we do not have our partners from LUC. We have instituted high-risk patient wanding. So when we're in the emergency department, you come in, if we identify a patient as high risk, they would come in whether they're here for homicidal ideations, suicidal ideations, ETOH, drug intoxication, mental health evaluation. They're flagged as high risk. First thing that'll happen is that security will come over and make sure that we do a handheld search with a metal detector, and then also make sure that we take their belongings to be able to separate them from anything that could possibly hurt our staff in the future. From there, we do what is called as the buddy system. So the buddy system is right after we're done with the wanding, security is able to remove their stuff from the room, and now they're on our radar as somebody that we need to watch, whether they're pushed up into the hospital upstairs, or they're going to stay with us and be dispositioned somewhere else. And then obviously because of that, so we have instituted a lot of, as I mentioned before, as a lot of these situations are happening, there's a lot of new technology. So we always keep up on that to make sure that we're prepared to understand that we might have to continue to add layers for us. So, you take a look at stuff like the Evolve system. You go to a Cubs game at Wrigley Field, you walk through a metal detector, and it shows you exactly where on your person you would have a weapon. We also, they've invented those amber box gunshot detection systems to be able to get the message out to police as fast as possible. So we're always kind of evaluating the new technology and deciding what we would be, what we could possibly be put in from there. And then a couple of things that we've done here more so on the campus is we've added a lot of duress buttons, improved our partnerships with our local police departments, added nonviolent crisis intervention training to make sure that our associates understand when there is an incident that is escalating, that they're able to pick up on that a little bit faster. And be able to deal with that appropriately, whether remove themselves from the situation or get more help. So, that's what I came here to share with you today, is kind of what we're doing across the board here. But really, I think when we talk about stuff like this, education, preparation, learning from past tragic events, and putting things into play that would be able to help us in the future and kind of deal with these things and keep everybody safe. Thank you very much.
All right, good morning, everyone. My name is Tim Cunningham. I'm a commander with Loyola University Police. I've been with the department, the university, for 17 years. 16 and a half of those years, I was at the Lakeshore and Water Tower campus. And then in October, I moved out here when Loyola Police started having presence here. I want to say I'm mildly disappointed in the presentations today because they stole my intro that I have used for like 10 years. And I'm disappointed because it means I need to make something else up now, but I'm happy because it means that the message is getting out. How many times did someone here today mention you walk into a room and look for the exits? At least 3, right? Okay. Right now, pop quiz. How many exits are there in this room? There are 3. Yes, there is one back here behind the stage. What's funny, though, is if you've been watching the people who get up to go get a cup of water or a restroom, the people over here are still using this door over here. That's something that I pay attention to. My wife is also a police officer, and her and I went to a concert 2 weeks after the incident in Paris back in 2015, where there were a bunch of shootings all across the city in cafes, at a soccer game, and at an actual concert. And her and I, it has always been our just kind of routine. We walk into a place and we point things out. Oh, well, there's the exit up there. Well, the closest one is actually up those stairs over there, but we can get down that way. And my friends started laughing at us. And it scared the hell out of me, because I was in a building with about 20,000 other people, and I wondered who else was looking for the exits and what that meant for everyone's survival. I'm going to kind of talk about the reactiveness to shootings. We do work a lot with Scott and his group here, but I want to talk about campus safety's response. We are fortunate that we get time with all of our students in the undergraduate level at the Lakeshore and Water Tower campus. We get an hour with them the first month that they're on campus, and we specifically go over all this active shooter type stuff. It's sad that we have to do it, as you all know, but we're happy to at least have that opportunity. It's also sad that most of the kids have already heard everything we've said, which is another scary thing, that we have to worry about our children that young, either having firsthand experience in gun violence or having to go through those lockdown drills and active shooter drills. But we do proactively reach out to our students and try and help them understand what they're supposed to do. Like Scott said, we also subscribe to the FBI's Run, Hide, Fight. If you start hearing shots, or if you think something's about to go down, run. If you cannot run, then you have to hide. Get creative. There's a lot of places in here that you could hide. Don't just go for what you think is the closest thing necessarily. And unfortunately, if you have to fight, that's the last resort. But that could be something as simple as throwing your, I know you won't throw your phone at a person, but you might throw your Subway sandwich at someone. You might throw a book at someone. You might throw your shoe at someone. The natural instinct is for someone to duck. And if that gives you half a second to move in another direction, get safety, that is what I suggest you do. I want to talk about what we do proactively as a university. We have had behavioral concerns teams, and we've had threat assessment teams in place for many, many years. Behavioral concerns team will look at anyone who has some sort of concerning history or present kind of mindset. That could be anything from an eating disorder to drug use to threats on social media or weird postings on a blackboard in a classroom, whatever it might be. The overwhelming majority of those just turn out to be a weird kid, because there's a lot of weird people in this world, right? You might have a weird kid yourself and you go, yeah, that's probably my son, my daughter. It's okay. But we still look at every single one of those things and we treat them as a high level threat until we know that they are not. And if they become a kind of more, a bigger concern to us, we escalate it to a threat assessment team. And that's a multiple disciplinary group of professionals on the campus that will meet to assess medically, legally, behaviorally, every kind of way you can think about, and what type of intervention we need to do. Does that mean we need to bring this person in for a psychiatric evaluation? I have driven many students to psychiatric evaluations and sat outside the room to figure out where their mindset is. Does it mean we need to take them to the emergency room for some other underlying problem? These are things that we are actively doing every single day. What's important to point out is that wherever you are from, if you're not from Loyola, I almost guarantee you that your organization, your institution has those similar programs. If you don't know about them, please seek them out. All of those students that come to us are referrals from someone else, from the people who are living and working with them on a daily basis. You're going to see a lot more than we ever will. It always happens after one of these shootings that someone goes, there's something up with that guy. I always knew it. He was weird, but I just never said anything. Don't be afraid to say something. In the vast majority of these incidents, they never turn out to be anything, but let us chase that down for you. Finally, I'm going to say one more thing, and that is about your role as either a healthcare professional or an educator or whatever it might be in the Firearms Restraining Order Act, the red flag law. It's relatively new to Illinois. It's only a couple years old. I encourage you to know your role in that act and what you can do to either report someone through the Attorney General's office or state police, or know who you can talk to get that referral placed. The numbers are actually kind of surprisingly low, to me at least personally, for how many red flag referrals are actually made versus how many are actually vindicated, if you will, or confirmed. But please know your role. And if you need to run, if you have to hide, hide. If you have to fight, fight. Thank you.
Thank you for your time today. My name is Purvi Patel. I'm a trauma surgeon here at Loyola, and I think I have a slightly different perspective as a healthcare professional that sees patients that come in suffering these injuries. So I have a two-part kind of reflection. One is as the provider taking care of patients that are the end of gun violence. And then the other half is being a healthcare professional in a place where gun violence occurs, and how do you protect yourself and your peers when you have combative patients, but also there are a lot of active shooters, you know, in the ER, in the trauma bay, and how do you, as your responsibility to your patient, how do you run? Do you, or do you take care of your patient in front of you? So I think we do a lot of partnership with our security. We do partnership with our Loyola injury team here. And I think it really for us is much more of an individual specific patient interaction. Every patient that comes after suffering some violent episode or injury, initially our goal is, preserve their life and try to get them through that initial stage. And that is sometimes very demanding, both on the surgical team, but also for our families that are watching us take care of these patients. They're suffering a lot too. So I think our chaplain services do a great job helping us communicate with them. The key is after they get through that, their survivorship, I think, is very important in a place where we can intervene at the individual level. So to make sure that they leave our hospital with resources to deal with the psychological impact of that injury. We do have psychologists that are often that see most of our patients before discharge, but we also screen for PTSD in our clinic and then provide resources based on those that screen positive. I think it's also a time for intervention. Oftentimes you see patients that are like, my family member was here a month ago with, suffered a gunshot wound to the leg. I was here. I've already been shot in the abdomen and now I'm shot again somewhere else. And I think that, there is a opportunity to say, how can we help you? And a lot of people are going to an environment or back into an environment where they feel they're stuck and they don't have the resources. And I think this is an opportunity that's a safe space while they're in the hospital to figure out, how do we change that cycle? How do we get them the support they need once they leave here? I think sending a patient back to the same environment where they're having issues with housing or having even food necessity issues, I think this is our place to intervene and try to provide outside resources. While I was at Cook County, we actually used to have patients or members of the community come talk to our patients while they were still admitted and say, hey, I've been through this and this is how I got out of this. And I think that was a great resource that we utilized and maybe something that we could even consider implementing here. As a provider, I think it's sometimes scary being in these situations where we talk about, what is our active shooter drill? What is your job here? We talk about run or hide, run, fight. Sorry, I'm butchering that. But, I actually just went to a disaster mitigation course. And as a provider and, as a physician, as a nurse, it's hard to run away from a patient that you're taking care of. The ICU nurse is not going to be like, oh, I'm going to keep my intubated patients here, but I'm going to go hide in a closet, right? So they kind of teach a slightly different perspective for providers, saying you secure yourself. They have locks in certain places. They have ways to secure a facility, close the doors, take care of the patients that you feel responsible for, that you do not want to leave, right? And then you try to preserve your safety, preserve your patients. And then at that point, if the shooter comes at you, then you have to fight. But a slightly different mentality that really struck me as a provider, because I know if I'm in the middle of something, I'm not running away. I'm going to take care of the patient in front of me. So those are my perspectives, and I look forward to your questions.
Well, hello, everyone. I get to sit at the end of the panel of all these amazing people who are doing things. Again, my name's Amanda Oliver. I'm the Trauma Injury Prevention and Community Education Coordinator here at Loyola. And I hold kind of a multitude of roles in the way that we work on injury prevention, and part of that is with the gun violence epidemic. So part of my job happens inpatient in the hospital and outpatient with the patients and with the community. So some of the things that have been talked about previously, such as the PTSD screenings that we do with our patients, we help manage that and bring all of those resources to the table. But I want everyone to be aware that the work that gets done through injury prevention is never a singular person alone. There is an entire collaboration throughout this entire medical center of people who are working together to help all of these patients. So social work and care management are one of the teams that I work very closely with, especially when we do talk about patient safety and them returning to their environments post-discharge. There's been several times where we've had to collaborate to be able to ensure that we have the ability to provide these patients safe access to places to live. I know earlier today, Mayor Booker did bring up some statistics about Maywood and the Proviso area in results to gun violence and the numbers and the data. Here at Loyola, I work with a team of wonderful registrars and abstractors, some of which who are probably listening and are in the audience. And we actually watch all of that data to help us watch our trends and see if any of our interventions or things that are happening in the community can be impacted by the things that we do. And I did want to just provide some of those numbers that were provided in a report that just came out for last month, and that we are on, as Mayor Booker said, a very large downtrend in the number of gun violence victims that have been in the Proviso area. For example, in 2021, we had 173 victims, 122, 93, and in 2023 so far, as of last month, there was only one victim of gun violence in that month. So we are doing tremendous things, and yes, data can change and things can change, but we have to stay very diligent in that. One of the things that I do that I know isn't prevention, but definitely starts conversations, is the Stop the Bleed program. You guys should all have a flyer that was in your program today about our next training that's going to be for the community that's coming up on June 28th here. It's going to be in the room that's right outside this room, so you'll know exactly where to go. But it's not necessarily prevention, right? And we're talking about a strategy of post-injury. It's not necessarily just for gun violence either, but it starts conversations and gives us the ability to open the door to have broader conversations about how we can get involved with organizations, especially those who do deal with gun violence on a very regular basis, such as partnering with Hood Heroes and Legacy Disciples. We've also partnered with the Chicago Institute for Nonviolence, who is a violence interrupter group in the city. So there are so many ways that we try to ensure that we impact our patients in that way. In addition, you saw in Ms. Chris Brown's presentation, the work of medical students that is being done in all of the aspects of gun violence. We know that there's so many sectors and so many different ways you can approach. And my job really is to help try to facilitate as best as possible to get you resources, information, collaboration in any way possible. So for those who are here and haven't met me and haven't worked with me on things like that, please know that I'm one of your resources to be able to provide that information to you. In addition, I do want to give a plug because we are coming up soon, which is May, which is Trauma Awareness Month, which is very near and dear to our hearts here. And we are having, the first time since COVID began, a trauma awareness event. And that is going to be taking place May 20th here in the Loyola Outpatient Center. And we are going to be discussing, having tables, information, and lots of learning all around different sectors of trauma. So not just gun violence itself, but multitude of different ways. And it's entitled our Treat, Heal, Prevent event. And we are here to really make sure that we're collaborating with the community and all the resources that are available, not just here with us at Loyola, but far and beyond what we can just provide. So that'll be happening, and you can get more information on Instagram and Twitter at Loyola_injury. So follow us. In addition, you know, there's so many different things that have been talked about today, such as the 988 initiative that we helped deploy with our emergency medical staff. and things like that. But I'll hold there for the ability to have time for questions, as I know we're coming to the end. But we greatly appreciate the partnership that every single one of you bring to our organization. It only makes all of us stronger. So thank you very much.
Thank you all so very much. I appreciate listening to panel speaker because I'm like, oh, I can totally get in on what they're doing. I can get in on what they're doing. I'm thinking that. So it's an opportunity for us to kind of collaborate and think of where we fit in. Not all of us are politicians. Not all of us are lawyers. Not all of us are in healthcare. So just figuring out where you fit in and what your role is going to be in that spot, key. So right now, I just want to open it up to questions. Does anybody have any questions for any of our panelists?
Testing, can you hear me? Okay, a question I have for something that has been in my thought process for a while, and that is the relationship between alcohol, drinking alcohol, and violence. We all know that when we get intoxicated, we kind of act differently, right? So I'm thinking that we need to do some kind of awareness that, because if a person who is intoxicated has access to a gun, 9 times out of 10, they could pick that gun up and shoot somebody, right? Why don't we raise awareness of, the relationship between risky behavior and drinking alcohol? So that, we can put people on notice that, that's an issue that we need to be somehow or another dealing with. I don't know how to deal with it other than to just bring it up and increase awareness that alcohol tends to give you courage that you wouldn't normally have, if you weren't under the influence of alcohol. And I guess the question I want to know too is, whether or not in the emergency room, when a victim comes in, is there any testing done of that person's blood to see what the alcohol content is? It seems to me like there should be, there is a relationship, we all know this, matter of fact, but, are we doing anything to raise awareness? And I'm thinking, have a video that shows how stupid you get when you're under the influence of alcohol. And maybe people would think about that, before they pick up a gun and do something. That's my comment.
So hello, thank you very much for your question. Inpatient, we do very much monitor that. We mandatorily provide screenings to patients who are have alcohol levels over a level of 80, which is the legal level of intoxication for driving. We know everyone's not driving, but just to give us an indicator there. Now, we screen them. I talk with them, we provide them resources if their alcohol use is at a certain degree that does provide a risk. We do not do a correlation between the gun violence and the alcohol consumption because we're not always necessarily aware of perpetrator versus victim, and we cannot victimize people whom already may potentially have a disease of alcoholism and have been a victim of gun violence. But it's definitely something to consider as something to look at for the future of how we can ensure that the populations who are affected by gun violence and the use of alcohol, how we give them more support to be able to get both of those things rectified for them in a holistic manner.
So thank you so much for your question. In the effort to keep respect for people's time and to get the other events moving forward, we're going to wrap up this section of our summit and then move on to the next portion. So thank you all. I'd like to introduce Chaplain Michael Hayes to the stage.
Thank you, Sarah. Hi, everyone. Again, my name is Reverend Michael Hayes, and I'm an overnight chaplain at the University Medical Center across the campus. A shout out to all the colleagues that I see from the overnight shift in the audience, because we all work hard. And right now, I'm so sleepy, my eyes are crossed because I worked last night. But what I'd like to lift up is today's theme, right? So today's theme is it's time to act. And we've spent most of the morning sharing with you stories of people that are already in action. But I wanted to refocus us to at least consider those of us who may be in the audience or maybe watching virtually, who are sitting on the fence and, you know, wondering what it would be like to act. Sometimes people sit on the fence because they think the only way that I'm going to get in this game is, well, I'm not going to get in this game because they're really looking for a superwoman or superman. But I would say to that person, it's very rare that we get to choose the moment that we can make a difference. More often, it's the moment that chooses us. And to illustrate that story through the wonder of modern technology, I wanted to lift up a story of a person whose moment chose her. I'm speaking of none other than Representative Lucy McBath of the 6th and now the 7th Congressional District of the great state of Georgia. And here she is in an interview I did with her to tell her story about her moment.
Good morning, Congresswoman. You were born and raised in Joliet, Illinois. Your parents, Dr. and Mrs. Holman, set a distinct impression on you by caring for others as clinicians and being advocates for the African American community of Illinois. Your father, Dr. Lucian Holman, owned The Black Voice, an African American newspaper, and served as president of the NAACP Illinois chapter. You received your bachelor's degree in political science, and after college you worked as an intern for former Governor Douglas Wilder, the first African American governor of Virginia. When looking at these early data points of your life, one might imagine that the seeds were planted if you wanted a life in public service. Yet you chose a different path, and you relocated to Georgia, became a flight attendant with Delta Airlines, and raised your family. And then 2012 happened. The nation heard the tragic story of your son Jordan, 17 years old, murdered in cold blood by a man who opened fire on the car your son was riding in with friends over an argument about how loud their music was. Here's my question. After your son's tragic death and the court case to bring him some semblance of justice, you made a monumental pivot. You turned your life's direction first to advocacy with Moms Demand Action for Gun Sense in America, and later back to public service, running for Georgia's 6th Congressional District. Is that pivot you made normal, or is that superhuman? What would you say to another parent who has lost a loved one through gun violence, who is busy living their life, but yearns to do more to bring peace and justice to our country and our society?
Well, first, I want to thank the Loyola Stands Against Gun Violence group for putting on the 4th Annual Community Advocacy and Violence Prevention Summit. And I want to thank the community leaders and all the elected officials of Proviso Township. And thank all the loved ones of victims of gun violence who are just still coping with this loss. We're always coping with it. And thank you for considering advocacy in memory of them. And in turn of all the things that happened tragically with my family, with Jordan, each and every individual processes their grief differently. Each and every victim processes the loss differently. And so I would say is that what I believe I've been able to accomplish in turning my tragedy into activism and coming to Washington to change the laws that would prevent these kinds of tragedies from happening, I would never say it's superhuman. I would say it's just my way of processing what has happened to me and my family and what I've learned to see is happening all over the country. And as I continue to work with victims and communities that are really growing in numbers, that are really trying to change the culture of gun violence, I would say that it's just my process and my way of taking all of that concern and love and that I would still be giving to my son if he were alive, and just channeling that through activism, through advocacy, and through work in changing the laws. That is how I am still processing Jordan's death. And it looks different for each and every person.
For many Americans, the U.S. Congress is the ultimate arena where positive, lasting change can take place in our country. Yet, because of the entrenched interests against change, all the sausage making and compromise can sometimes diminish the results for those who demand it. What has your experience working in this battleground of competing interests taught you about how to work across the aisle while remaining committed to being a change agent?
Well, there are a lot of competing interests in terms of a lot of different organizations that are working on gun safety. And each and every one of them has a direct focus. And I'm really excited that now the organizations, whether they be just organizations that are working on movement building with survivors and victims, or whether they're working on changing the laws, working through the judicial system, or they're working legislatively, or whether or not they're working specifically with law enforcement. Each and every one of the organizations that is working on the ground now, and some are very small organizations that are working within communities, and they may not have many resources, and they may not have a lot of manpower, but they're still doing the work. I'm really glad to see organizations all across the country coming together and collaborating together. That is how we've been able to change the laws in some sense, the Bipartisan Safer Communities Law. That's the first monumental legislation we've been able to pass in decades. And that is because of the collaboration and the effort of all the organizations, all of the gun violence survivors and victims and stakeholders that really are on the ground and trying to save as many lives as they can. And this is how we change the culture, and this is how we move forward to save lives.
Is there one particular piece of federal legislation that's on your radar right now?
Well, right now, the assault weapons ban is extremely critical and important. Yes, we have passed the Bipartisan Safer Communities Law. Yes, we have closed the boyfriend loophole for domestic violence abusers, making sure that they're not allowed to have access to purchase guns. But we still have a lot of work to do. And a piece of legislation that I will really be focusing on going forward is the assault weapons ban. When we take surveys around the country asking everyday Americans, what are they afraid of? What is the one piece of legislation that they believe, really has to be focused upon, and that legislatively we here in Washington are responsible for banning, and that is assault weapons. The tragedies that we see around the country, the numbers of horrific tragedies in schools and movies and at concerts, these tragedies are happening with the use of assault weapons. And we did ban assault weapons, but that, we have banned the assault weapons, but that ban has sunsetted. So now we have to make sure that we're passing the legislation again. And so that will be my focus. And also, I'm understanding by talking to everyday people, that is the one piece of legislation that they really, really want us to champion at this point. So would love to have your help, would love to have your engagement, and would love to have you on the front lines with me and so many other organizations and individuals that are wanting to save lives.
Thank you so much, Congresswoman McBath. You and your staff have been amazing. Our summit theme is Time to Act, Advocacy Matters. We are all sitting here, community members, civic leaders, and elected officials of Proviso Township, students and researchers of Loyola University, clinicians, and administrative staff of Loyola University Medical Center. You have our ear and our attention right now. What is one deliverable this audience could do today to help our local community? Are there any ways you would recommend for local communities to stay engaged in the fight against gun violence?
Well, first, I want to say thank you so much for paying attention. I want to say thank you so much for being engaged. Thank you so much for, standing on the front lines. It takes that kind of effort from so many people across the nation to really make effective change. But what I would encourage you to do is continue to build upon the work that you've already done. Continue to expand the ways in which you are affecting change within your community. Continue to speak out, symposiums, roundtable discussions, talking to your local municipal leaders, law enforcement, and yes, your local legislative body. It's really vitally important that we continue to keep the pressure on our elected officials and our municipal leaders, because that's how change happens. Federally, I'm working here to change the laws federally, but most rapidly the change happens within the state, within your own community. So continue to do what you're doing. It really, really matters. I cannot thank you enough for your engagement and your involvement and your vision to really see beyond where we are right here today and really think about the impact that you'll have on the future of gun safety and saving lives in America.
What an impactful message. Thank you, Congresswoman Lucy McBath and Chaplain Hayes for facilitating that section. We're now going to move on into today's gun safety and violence prevention workshop. I am honored to introduce Delphine Cherry, whose fight for justice began in 2013 because she wanted to stop others from feeling the pain that she feels every day because of the loss of her two beloved children. Instead of allowing her grief to defeat her, she began to fight back to becoming an activist. She founded the TY Tender Youth Foundation, named after her son. Later that same year, she became the co-chair for Brady Campaign Chicago's chapter. She believes that she can no longer just sit back and be a victim or a bystander. She has to do more to stop gun violence. Through her work with the Brady Campaign, Delphine has built an alliance of gun violence prevention activists in Illinois. Please join me in welcoming Delphine and to accompany her back up here, Miss Chris Brown.
You want to kick us off, Delphine? I think it's on.
Okay. I guess it's good afternoon. I'm glad to see everybody here. Thank you for inviting me, Loyola. This has been very informative. I got a lot out of it. My space is a little different. I came here because I had no choice. I wasn't given an option of what I wanted to do with the rest of my life. Starting out in 1992, my 16-year-old went to the movies with some friends like teenagers do on a Friday night. And as she was leaving the theater, a group of guys got into a fight. Unfortunately, my daughter took a bullet to the head and was murdered instantly. She was a senior in high school, getting ready to graduate, and she wanted to be a nurse. It's funny, I'm in a hospital now. She wanted to be a nurse, and She was a giving soul. She was only 16. She had a whole life plan for her. And it took me to a dark, dark space. I'm really dark. When we talk about that grief and mental illness and a preventive measure and what it can do to you as a parent, because now I'm a victim of gun violence, which I never thought in a million years that I would be. I was pregnant with my son at the time that Thaisa was murdered. And I felt like I had nothing to live for, even though I had other kids, that he was being born 9 months later, and he came into this world, and I went on as a parent to do the best I could. Went back to school, just made myself useful, got my degree in criminal justice. 20 years later, 2012, my son got off work to go to a friend's party and got dressed and he never made it out my driveway. He was shot. He was murdered. They said it was a robbery gone bad. I don't know, because his murder is still unsolved. And still today, I look for that murderer. I look for peace. I look for peace. And it took Brady to literally save my life. A friend called me and said, "You need to go to this rally." And I'm like, "Girl, I don't want to go nowhere." She's like, "Where you going?" And I went to a rally at Chuck's gun store, and there was Brady. And I was so interested in guns, lobbying, bills, and they had every tool that I needed to get me through. The only problem, we didn't have a Brady chapter in Illinois. A couple of weeks later, somebody texted me like, "Hey, we're going to start a Brady chapter." I think I traveled maybe an hour and a half to get to that chapter because I know that we needed Brady here. And I went, and maybe a year later, the two young ladies that started it dropped out. So now I found myself fighting by myself, one-man team, but I didn't mind it because Brady gave me the tools that I needed. And I remember being with GPAC, Illinois Council Against Handguns, and they had a bill, certification bill. They had been trying to pass it for 11 years. I'm like, what is the problem with passing this bill? We can't get the senators, state reps to come on board. They taught me how to connect with my senators, state reps, local officials. And I did. I literally went to offices, talked to them, went to Springfield. I needed to know why you can't support this bill. I have 2 children here that's dead. Why you can't support this? And after I told my story, most of them got on board. So then I became the chapter leader. We have an amazing Brady team now that we're stationed all over Illinois, and we would love to have more people come and be a part of Brady. When the certification bill got passed, it actually got passed January 17th. And I want to say 2017, 19 was the same day that my daughter was murdered, but it was 27 years later. And that could not have been a better gift for me because it let me know that I am doing my job, keeping my children legacy alive. And with Brady was always in the forefront of making sure that I got to those bills. I got to Springfield. They did what I needed to do so that I can be the voice of my children and Brady. So, I mean, I can't say it no better than this is I had some asked questions, some talking points, but I really don't need that. I've been doing this long enough to know that I know I'm in the right place. I know that I've been doing the right things. I know that Brady has been on the ground and the foots. We've done a little bit of everything. We, as an organization, I remember when COVID came out, we have an amazing teaming up, which are our teams. And they went out of their way to make sure people that had COVID supplies that they need. They were at the marches, marching alongside March for Our Lives and everybody else. I remember Alea from Sandy Hook coming to live with me. And that was the most emotional part, me being a victim and she also being a victim, that it was the 4th of July. And every time she heard a car backfire or firecracker, she went into a panic mode. I'm just glad I was there to be able to hug this child, because I knew that there was chances that she would not have been there if she had not have done what she did to survive. So I come to this space to say that I'm grateful. I'm grateful that I'm still alive. I'm grateful that Brady taught me to fight instead of lay down and be what I wasn't wanting to be. My thing was, I've lost 2 kids. I've been the best mother I thought I could be. And I could have been somewhere else. I could be in jail. Because I've thought about it. I thought about shooting people. I thought about just breaking down and not waking up. But with the tools that I have to fight, I like it so much better than anything else. Going to Springfield. I have a friend over there, Tanya. I think the last time we was in Washington in December, she ran across, was it Mitch McConnell?
No,
Karen. Corinne, we ran against Corinne. She did. We were walking together. Next thing I know, she turned around and she's yelling at this man from the top of her lungs. And I'm like, what the heck are you doing? She's like, you didn't see that? I'm like, the only problem we didn't have a camera to just get her. And we fight together as a community, as a group of people. We don't single nobody out. All of the coalitions come together to fight as one. But this one fight hard. She fight hard. She fight hard. She fight hard. So I really want to say, get on board with Brady. We're doing some amazing things here in Chicago. And we need your support. You can always go to www.brady.org, bradyunited.org, and just register to be a part of Brady. I'm not going to say much more because I'm almost in tears. I've waited for this all day and listening to everybody else's story. I'm like, wow, it's always a story. And when the gentleman talked about Stop the Bleeding, I have one of those kits in my car that I give out when I see people. I know with Brady, I gave out gun locks. I'm like, okay, if you're gonna have a gun, please lock it up. I've been to schools talking to kids where 3 or 4 kids were shot in one school. That's Henderson. Dion, as you hear, he might have left. And we marched every year to support this school. So there's a lot of things that we do. If you have any suggestions for us to do some more, just let us know. But I'm always here. I'm a phone call away. Thank you.
I'm standing next to a living legend here. So just want to acknowledge Delphine. Thank you for everything you do every day. For those of us in the movement who have not suffered as you have, you are an inspiration to me and to so many of us to get up and put one foot in front of the other. If Delphine can do it, every single one of us can. So I think now is the point where we want to get some advocacy going. So I'm going to turn it back over. You know that we talked a little bit today about spheres of influence. We have that at the local level, at the state level, at the federal level. We have so many organizations doing amazing things around this. Enforcement of the law is really important, social norm change. And we'll start with advocacy and how simple it is. And I want to say one thing before I turn it over, which is having worked on Capitol Hill for 8 years, I know the difference that constituent emails, texts, calls, you name it, make. And I've talked to a lot of lawmakers on the Hill, especially over the last couple of weeks, who say, please pick it up. We want the offices of these legislators to be inundated with calls, with texts and emails. So we're going to figure out how to do that and make it super easy. And I'm just so grateful to everyone here for this incredible conference, the inspiration, and helping us be activists. So thank you.
I'm sorry. I'm sorry. I missed the point. I really want to say thank you for every gun law that we have passed in Springfield. It has been 4. You know, it's been 4, and I've had the honor to be there at every last one. But the last one was kind of funny. I'm just going to say this, and I'm going to leave. We were in Springfield trying to get the assault weapon ban passed. I was tired and I went home. I got a call the next day, say, look, we're passing this bill at 6 o'clock. And I'm looking at my clock like, hey, you know, it's 4 o'clock, right? He's like, can you make it down here? I'm like, well, it takes me 3.5 hours to get there. And then I get this friend that say, I'm on my way to get you. I leave out my house with my wig in my hand and my shoes in my hand. And she said, hey, you got to drive. I'm like, drive. I'm like, okay. So I say, well, put your seatbelt on and close your eyes. She said, why do you need me to close my eyes? Because I don't want you to see what I'm finna do. So we were supposed to be at Springfield at 8. We got there 7:53. We had 3 minutes to get upstairs to the Capitol, which we did. And she looked at me and said, Delphine, I didn't know you can drive like that. I said, because I don't tell anybody I used to drive a Holly.
Thank you so much to Ms. Delphine and to Ms. Chris Brown for that introduction. And we're about to get our advocacy on, shall we say. And we have a very easy way for you to do that here with us here at Loyola. And we are going to be sending messages to our federal legislators about the assault rifles ban. So that would be Bill S-25. And so we have worked with our advocacy team here at Trinity Health to be able to partner and make it very easy click to send message for you all. If you would like to scan the QR code that is on your screen right now, it's going to bring you to the messaging page. The message is able to be edited if you'd wish to add a personal message to your legislator, but we do ask that you keep it short and brief, that these do make an impact when they're shorter and cohesive together and there is a word limit. But we do say if there is more you want to say to your legislator, please reach out to them individually, make appointments, send them additional letters, and be able to contact them. As you go through, you're going to fill out your personal information, including your phone number and address. This helps our system be able to locate your specific legislator to send the message to. You're then going to select no for board member. We're not board members of Trinity Health, so we're going to say no to that. And then you're going to put your home address and your Loyola Medicine affiliation. And then you're going to click send message. And that is as easy as it can be for advocacy. So this is just the start for all of you here today and online to be able to start those conversations with your legislators. Please remember they are normal people, that you can talk to them and they want to learn from you. You are the experts about gun violence and whatever right that you have to it. And they are the people that they want to listen to you. So I'm going to leave this up here for a couple of minutes. If anyone has severe technical difficulty, I can try to assist, and we can just go from there. So I'll give about another minute for this. And we'll put it back up at the end if you guys don't get to it right now, but I do want to show just one more slide. So just additional ways to stay involved in advocacy for, more topics and beyond. You can use this QR code here to access our advocacy advocate webpage and resource center here for Trinity Health. You're able to see our social media efforts and help provide assistance to those as well. And we want you to keep involved and be able to give us the ability to stay in communication with you so that we can continue to advocate together, because we know that all voices together can bring much more change than we can do individually and alone. So I would now like to bring Professor Amy Luke to the stage to give some closing remarks.
Well, it's great to see you all still here. Thank you. I want to thank you all for attending the 4th annual Loyola Stands Against Gun Violence Community Advocacy and Violence Prevention Summit. And thank you to our wonderful presenters. You've all been phenomenally impactful. And I'd also really like to let people know and express my sincere thanks to Maywood Fine Arts Association. They're the children who made the artwork that you'll see outside, as well as on our flyer. In 2016, Loyola Stands Committee was formed, and it was really to understand and act on the gun violence issues that in our own backyards. And it's our hope that we continue to collaborate with you all, not only on conversations and actions like action items we see today, but on future initiatives to reduce and prevent violence in our community. As a Maywood resident, myself, and a mother of a teenage boy who walks the streets of Maywood and rides his bike. And as you have heard, Maywood has a longstanding gun violence issue. So this topic and these issues are near and dear to my heart. And I know that we can affect change. And we've heard that today. We've seen data around the actual success or the success of advocacy. And so it's absolutely true. Advocacy matters. It really is time for us to act. Now, I'd like to note that in your program, it includes actionable steps that you can take today. So take a look at all of these. There are multiple options here. You can reach out and make your effect. And we'll soon reach out to all of you and all the registrants, at least. If you haven't registered, please do so at the front desk. Give us your name and your contact information. We're going to send some follow-up information about today, including an evaluation and how we can improve our summit for coming years. If you have a question that was not asked or answered, please drop your Q&A card at the registration table, and we will include information in our follow-up communication. And I want to say, although I have been involved in Loyola Stands since its founding in 2016, it really is the folks here who have worked really hard to pull this summit together. And I'm going to miss people, but right off the top of my head, I really want to thank Lucia Garcia. I want to thank Dee over here, Idiake. I want to thank Sarah. I want to thank Michelle. I want to thank Amanda. And I know I'm missing people, but they've done a tremendous job to pull this together and to really, I feel, and those of us who've been to many of these, I feel like this is really the most impactful summit that we've had to date. And so I really appreciate all your hard work as I just read the emails that came through. So I want to thank you once again and for your commitment to ending gun violence in our communities across the country and in our own backyard. And I also urge you to grab a lunch on your way out. And, you know, people will be out in the auditorium or the atrium. So stop and ask questions if you haven't had those answered. Thank you all very much.